18, 2003.
Raquel Hayes, May 18, 2003. Okay, perfect. I'm just gonna wash my hands and clean my stethoscope off and shut the door for your privacy. My patient appears calm and relaxed. His speech is clear. He's well groomed and small in stature. Could you tell me where we are today?
My house.
And could you tell me what today is?
November 14, 2025.
Okay, and then you already told me your name. My patient's alert and oriented ×3. And I'm just going to ask you a few questions. Do you experience chest pain or tightness?
No.
Okay, and how about a history of heart disease?
No.
And how many times a night do you awaken to urinate?
Once.
Okay, and then I'm just going to inspect your chest. I'm going to look at the aortic on the second right intercostal space, the pulmonic on the left second intercostal space, herbs pointing in the third left intercostal space, the tricuspid in the left lower sternum border, and the mitral in the fifth intercostal space, midclavicular line. I'm going to inspect for any bulges or retractions, any lifts or heaves. No lifts or heaves are noted. I'm going to palpate for any thrills or pulsations, and I'm going to palpate the apical pulse, and it is palpable. I'm going to now auscultate all of these areas, starting with the diaphragm of my stethoscope. Okay, S1 and S2 sounds were noted. Now I'm going to switch to the bell of my stethoscope and listen for any heart murmurs. Okay, no heart murmurs were noted. And now I'm going to measure the apical pulse for 60 seconds, and it was 75. I'm going to now move on to my peripheral vascular assessment. Do you have any pain or cramping in your legs?
No.
Any changes in your arms or legs?
No.
And any swelling in your legs?
No.
Okay, perfect. And then could you turn to your head to the left? And I'm going to inspect for any JVD. And then this way. No JVD noted. I'm going to inspect and palpate the carotid artery on both sides. It's equal bilaterally, and now I'm going to listen with the bell of my stethoscope. Could you hold your breath for me? And turn towards me. Okay, no worries were noted. And now I'm going to inspect and palpate all of your pulses. Can you hold your arms out for me? I'm going to feel for the radial pulse and the ulnar pulse and the brachial on both arms. And they're all 2+ in strength. They're equal bilaterally. And the femoral artery is right here. And then I'm going to inspect and palpate the popliteal on both sides. Can I see this leg? Thanks. And then the dorsalis pedis right here, and the posterior tibialis. And they are also all 2+ in strength, equal bilaterally. And I'm going to feel with the back of my hand. Your leg feels warm on both sides. And I'm going to test for any pitting edema in the calves, ankles, or feet by holding down for 5 seconds. Okay, no pitting edema. I'm moving on to my lung and thorax assessment. Do you experience any shortness of breath?
No.
Do you smoke vapes, pipes, or cigarettes?
No.
And do you have a history of lung disease?
No.
Okay, I'm going to inspect the upper anterior chest for any bulging or retractions. I'm gonna inspect for shoulder symmetry and even unlabored breathing. I'm going to palpate for any tenderness, and there's no tenderness noted. I'm gonna palpate for crepitus. And then can you say 99 for me?
99. 99. 99.
No tactile firmitis. And I'm just going to percuss the upper anterior chest. Resonance predominates. I did it 4 times in each side, left to right. And I'm going to listen to you breathe. Okay, and then could you stand up for me and turn around? I'm gonna inspect the patient's upper posterior chest for shoulder symmetry, posture. Skin color is consistent with the patient's genetic background. And I'm going to make sure that the AMP ratio is normal. I'm gonna put my hands on you. It's 2-to-1, which is normal. I'm going to palpate again for any tenderness. Patient experiences no tenderness. And crepitus, there's none noted. And then could you say 99 for me again?
99. 99. 99. 99. 99.
No tactile firmitis noted. I'm going to percuss from left to right again. Okay, and then I'm just going to listen to you breathe one more time. Okay. Patient's breathing is regular and effortless and symmetric. And could you lay down on the couch for me at 0 degrees? I'm going to begin my abdominal assessment. When was your last bowel movement?
This morning.
And do you experience any nausea or vomiting?
No.
And do you have a history of abdominal surgeries or conditions?
No.
Okay, and I'm just going to inspect the patient's abdomen. For the patient's abdomen is flat and symmetric and consistent with the background, genetic background. The umbilicus is inverted, and I'm going to auscultate all of your vowel sounds in all 4 quadrants. Okay, and I'm going to switch to the Bellamont stethoscope and listen for any bruit. No bruit noted. And I'm going to percuss the abdomen in a zigzag motion 4 times in each quadrant. Excuse me. I'm going to palpate superficially in all 4 quadrants, noting for any tenderness. No tenderness was felt, so I'm going to palpate deeper and note for any organomegaly or masses. And no more noted, so I'm just going to document all of this, and do you have any questions?
No.
Okay.
No.